you. Okay, we're going to talk about the genitourinary system. Are we recording? Yeah? Okay. The genitourinary system is a combination of your genitals and your urinary system, and it manages your outputs as far as your urinary system goes, or the liquids go, and also it manages your secondary sexual characteristics and your sex drive. The male and the female genitourinary systems are not as different as you might think that they were. Both systems have a bladder, right? Both systems have 2 ureters. Both systems have 2 kidneys. Both systems have a urethra. And both systems have 2 gonads. Now, the location and the placement of these things are different, but the systems themselves are fairly similar. In our male reproductive system, much of this is located externally. The gonads are located externally, the urethra is located externally, and so that makes it a little more susceptible to damage than the female's gonads and urethra. So when we talk about injuries to the genitourinary system, unless we're talking about a traumatic injury to a female due to rape or a fall, like sometimes if you're riding a bike, you can fall and catch yourself on the bar, or, so unless you're talking about some type of traumatic injury like that, most of the injuries to the genitourinary system that we are going to see in the field are going to be injuries to men. They're going to be injuries to the external part of the genitourinary system on a male. Now, there's only so many things that you can do down there, right? And this is soft tissue, just like any other soft tissue injury. So you either have a closed injury or you have a open injury. Bleeding to the genitals isn't life-threatening. It's not. Men may think it's life-threatening, but it is not life-threatening. So if we have a closed injury to the penis, I can't believe I just completely and totally spaced off what it was called for a minute. If we have an injury to the penis, a closed injury, we may see some bruising. Maybe they got it crushed in a wrestling match or something, who knows, right? So we may see some bruising there. There's not a whole lot you can do to treat that bruising. If we have an avulsion down there, how do we treat avulsions?
Replace it? Like onto the...
Flip the flap back over and try and keep it from bleeding. How do we treat an amputation?
Bring the part with you.
Bag. Nice.
Yeah, we're going to bring the part with us. Going to try and control the bleeding. We're going to bring the part with us. This soft tissue is not really any different than any other soft tissue injury that you may see. Different to you guys. It's not different in the field of EMS. Just a soft tissue injury. I went to a lecture once where the speaker was talking about some of the things that he had seen in the field. And he was talking about having to respond to a patient who had something like 16 piercings in his penis and his testicles. And this paramedic, had to take all of that metal out for some reason. I don't remember what it was. And he said that when the guy urinated, when he peed like a sprinkler, because it went through his urethra. The piercings went all over the place and through the urethra, and so when he peed, he just, instead of peeing, it was like a sprinkler coming out all sorts of different holes. There's nothing you can do about that, right? If you're pulling out piercings, they're probably already healed. I can't remember. I wish I could remember. I need to figure out. I think his name was Stephen Baxter. Have you guys heard of Stephen Baxter? He writes a lot of EMS parodies, or he used to. This was several years ago. So there's not a whole lot that we can do to take care of those external injuries. There's also not a whole lot you can do to take care of the internal injuries. The kidneys, we have two of those, right? The kidneys are part of the genitourinary system. So if the kidneys are injured, your patient may be complaining of pain in their flank region, they may have bruising in the flank region, and they may have blood in their urine. There's not a whole lot that you can do to help take care of that. When it comes to women, and women who have been, or men too, because men can be raped or sexually abused, right? If it comes to something like that and you respond to a call like that, you are not supposed to encourage them to shower. You need to try and protect the evidence as much as you can, as cold as that sounds. If possible, you need to find an EMT who is of the same gender as they are, because it may help with the situation that they're in. It's a rough situation for everyone, and so trying to respect them and still maintain any evidence that is there is super, super important. Let's see. I should have just left that running when we did abdominal. Okay, when we talk about the external male genitalia, when we talk about taking care of it, there are some general rules that apply to that, including use a sterile moist compress to cover areas that have been stripped of skin. That's really kind of the only exception that we make to the soft tissue injuries rule. Those treatment options are on page 1078. If you are dealing with a person who has been the victim of sexual assault, you don't need to look at their genitalia. Unless there's obvious bleeding, and that obvious bleeding makes you think, hey, I've got to stop this bleeding, then you don't need to examine their genitalia. Just encourage them not to clean it up. Okay. Any questions about abdominal or genitourinary injuries?
Anything different you're going to do at the ER? As far as notification, personal privacy,
as far as somebody who's been the victim of sexual assault?
Legal stuff.
If you have someone who's been a victim of sexual assault and you're on scene with them, as soon as you realize that that's what has happened, you need to have yourself or your partner contact law enforcement. That's one of those situations in which law enforcement must be contacted. If you make it to the hospital before law enforcement gets there, then you need to make sure that...
Bring them to the ER.
Yeah.
Okay.
Anything else? No? Okay, go ahead.